now we got the biggest, most voluptuous, gargantuan, delicious, nutritious Brazilian butt. Come on, man.
Cause you a sex offender, semen spreader, gang banging like pretender. Switch your gender, you feel better. Drizzy, get your shit together. Think you got that fatty, I'm just trying to see it shake. Maybe you're really my daddy, gotta check that DNA. Lost all your money, gambling, now you bent over for state. I just wanna let you hit it, that outside the NBA. You got a heart in your head, you my little boogie bear. Drizzy, why you have to show us what's beneath your underwear? But BBL, Drizzy, gotta make that booty quick. And you straight at a cannon on my little maple leaf. All these dogs in the pound only want you on my leash. I don't wanna hear your rap. Put your hands on your knees. Put your hands on your knees. Put your hands on your knees. Come on, shake that ass straight. Yeah, shake that ass for me. Want that cupcake EDP. Taking kids like BMG. Need a book on parenting. This shit's quite embarrassing.
You almost put your shit in your head. Fall my thugs give a straight for your neck. You ride it straight in some lesbian sex when I come on your back. No, I'm coming correct. You rep the city that nobody care about. But that talking just getting your whereabouts. Cause I'm coming with shooters. We follow my losers. Your fans, they already get about. Who a proper public affair now. Industry plan like who is scared now. Girls in your van about to be a man now. Is that your man? Some predator man child. Don't act like you don't know me. Just booty is your bony. That shit make me so horny. Your max is below me. Your booty had a glow up. My penis got to blow up. That's BBL Drizzy. BBL Drizzy.
Bend that ass over, let us really see. Is it a BBL or is it lying to me? Bend that ass over, let us really see. Is it a BBL or is it lying to me?
This teenage fever got me scared to go to your shows. How you say you like them young, bro? You 37 years old. How can 40 keep you close? Tell me what OVO know. Got us laughing at your post. Just like Brian, you put a mess top you don't know. Yeah, push your T no more than me. I'm only 17. That's a scary part with you. Hope you do not come for me. You told Metro make some drums. Nobody told you text some teens. If you doing what you love and you like that, please do us a favor. Don't bring Mike back. You make the kids more scared when you write that. How the fuck you tell us beat it? What you thinking when you type that? Man, I'm really done. I know these scorpions don't bite back.
Shake that ass.
Don't act like you don't know 11. Don't act like you don't know 12. Always trying to be someone else. Always trying to display your well. I would never defend that shit. Tried your best, we saw you did. No euphoria, it's just kids. And we gotta save you quick.
Bend that ass over, let us really see. Is it a BBL or is it lying to me? Bend that ass over, let us really see. Is it a BBL or is it lying to
I
me?
used to always want a chance to get a small meeting with Drake, but I turned 18 in December, so I'm guessing it's too late. This goes out to fake personas with the even faker shooters. This goes out to all the dogs, all the sexual abusers. Yeah, the losers needed AI Pocket, AI Snoop for help. Cause no West Coast legends would've given up a verse themselves. Ask A, ask when, ask T, Mac 10, ask Mugs, ask Sen Dog, and you still wouldn't get a yes, that's sad. How you gonna fly girls out and get in first place? How you get so many beats in the first place? How you get abs in a week in the first place? Why do you only spawn IG in the first place? Scout out some artists so they benefit your team. Shout out Cryolipolysis, B12 slimming machine. They must have had you on that thing like 24/7. All your time on B12 when your daughter turned 11. Being caught a deadbeat twice in your life, I have to frown. You only cared about 11 when it was Millie Bobby Brown. Let's build this back up from the ground. We should have always been smarter. When they revealed you, I can't flog. Nah, we should have booed harder. Or at the very least, made our top charter. Someone honest or a real self-starter. Someone smart enough to make a deal to sign the weekend faster. And someone who knew not to start beefs when his life's disastrous. Just figure out the masters, and that's fine by me. When's the last time one of you people actually listened to Smiley? Spent 100K just to steal lyrics on a song with YG. Just think before you sign, unless you're just like them and what they do and think all of it's fine.
Bend that ass over, let us really see. Is it a BBL or is it lying to me?
チャンス波に乗れぬやつはマイクすぐに置けばいい。トレック前に興味ないし前の曲は聴かないし、ドクターシューズ履き潰してオースクールに履き替える。フレックスもメイキ履
れ落ちて錆びた中身現れるイエローのバスケットボールの車か捨てメトロトラック聞いて夢描いた今もこのステージたまに今も立ち止まるラップやめね何もない家族友達と遊びながら金を稼ぎたいお前も同じ気持ちだろ始めた当初金を得たら今のありさまそこんとこどうよ俺の周りもいいんだよ筋がどうだ義理がどうだそんなやつすでに殺してこのバスの前でオーバー
Una bala por cada puya, tú aguantas por su normal 3 por el ego que me lleva 4 por ponerte a gritar 5 por cada operación, 6 por cada menor de edad 7 por cada botellón con lario sin negrita robar Una bala por cada puya, tú aguantas por su normal 3 por el ego que me lleva 4 por ponerte a gritar 5 por cada operación, 6 por cada menor de edad 7 por cada botellón con lario sin negrita robar Con lario sin negrita robar Con lario sin negrita robar
Manek, chaque jour je les vide, je me sens comme Kendrick en 2016 J'imagine un peu l'industrie, je vois que des fakes dans la pièce Fuck tous les sionistes, ma nègre veut pas entendre leur take Ma bitch a un gros KV mais elle a pas fait de BBL comme Drake Yeah, ok, j'ai moins l'occasion de voir ma mère, mes familles still matter RPM on avance lentement, mais encore qu'au premier call Yeah, on les fera marcher sur Paname comme si c'était Terrell Carter Yeah, dans le tiroir, je garde la couche à côté du livre des Corinthiens Yeah, traîne avec qui tu veux, c'est ton poteau mais ce sera pas le mien C'est la nostalgie, je combat le feeling, et rip des Mac Miller
Bend that ass over, let us really see. Is it a BBL or is it around me? Bend that ass over, let us really see. Is it a BBL or is it around me?
They say Drake got a BBL. He off the old Zipic, it ain't hard to tell. They say Drake eyebrows about strong as a bitch. If he get too surprised, it might cause a glitch. They say Drake not allowed at Chuck E. Cheese. They saw Drake at Claire's talking about some bad teams. Drake not British, why he keep saying team? Drake might not know where he's from. Everybody say that I rap like Neff. Y'all might be right, I'm about to diss myself. Man, why you trying to rap like somebody else? I'm not even rapping, I'm dead ass just talking. Whole world out here ducking fade. Out here riding the bike with them dusty ass chains. Drake got addicted to perks at 30. Dot 5-1, he can't even touch net. They said Doc gotta jump to sit down. Quavo still mad about Chris Brown. ASAP Rocky don't know what to do. Please do us a favor, don't get in the booth. ASAP, please stay away from the mic. Just put on that fit, it's gonna be alright. ASAP, please do not respond. We don't wanna hear that shit, I'm begging. Zeke need to get some knees like Megan. It's not about football, damn I'm tripping. Jerry Jones might be older than Christmas. J. Cole dressed like a crackhead's wish list. J. Cole got crackheads on salary. Drake did what? Call Chris Hansen. They said Drake was on Epstein Island. He was there the same weekend as Deshaun Watson. Metro on the beat, I respect your talent. You still look like evil Miles Morales. Drake got CTE from being too freaky. Doc got CTE too cause he tweaking.
This cake will make you sore. I know you've seen it before. That's BBL, baby.
Hi, Bree. Welcome back. Oh, I see you brought the fam. I didn't know you had this many kids. It's really great to meet the Grams. Now, how was that BBL? Look, I'm glad that you didn't go down to Brazil. Can you finally sit down? How does it feel?
All right. So last week I went over HIV and immune system. So tonight I'm going to go over cancer. And then if you guys have any questions after we're done with cancer, like on HIV or immune, we can go back to that. If not, you can always message me on Remind, okay? I am going to record this session. So if you have a question, just throw it in the chat. I'll answer it. And I'm going to share my screen. I'll upload the recording and my PowerPoint right after this session tonight. Any questions so far? Good? All right. Okay, I'm going to go ahead and start recording. All right, here we go. Okay. Well, let me share my screen. That would probably help. Okay. All right, can you guys all see my screen? PowerPoint?
Yes.
Somebody? Awesome. Okay, all right, so cancer. Let's talk about cancer. Okay. So cancer is, when we think of the word cancer, it's usually associated with death. Cancer, you may think of pain or disfigurement for those who survive cancer. But nowadays, cancer doesn't always mean an automatic death sentence. Now, because of more advancements in technology, Um, people are able to survive cancer and live a long, healthy life. And then we've also got a better control of cancer, like identifying ways to prevent it, ways to screen for it, and then also how to treat it and minimize the complications. I did include a YouTube video more about cancer for you guys to watch different time. Okay, so how much cancer is there? Well, about 39% of Americans will actually be diagnosed with cancer in their lifetime. That's a lot. That's like three out of every 10 people are going to get diagnosed with some type of cancer. In men, the most prevalent cancer is prostate, but then the leading cause of death related to cancer is lung. So it's two different things. So just because it's more prevalent doesn't mean people die more of it. And then the other two are going to be colon cancer and rectum cancer. In women, the most prevalent is breast cancer, but the leading cause of death in cancer is lung cancer. So you can see lung cancer is the leading cause of death cancer-related death in both men and in women. And then after that, it's going to be colorectal. Cancer in general is the second leading cause of death. Heart disease is number one. And we see higher rates of cancer in those older than 55 years old and in African Americans. So what is cancer? Well, cancer, right, it's a general term for a lot of different type of diseases, right? But in general, it's this uncontrolled growth and spread of abnormal cells, okay? Okay. So, carcinogenesis, remember Genesis is creation. Carcinogen is going to be cancer, so the creation of cancer. So this is where normal cells are transformed into cancer cells. So what causes cancer? Well, it could be an external factor like an infection, exposure to chemicals, exposure to radiation, or tobacco use. And internally, cells can transform into cancer cells either because of genetic mutations, immunologic conditions like autoimmune issues, or even hormones. So how do we prevent cancer? There's different types. The primary prevention is to eliminate or reduce the risk of exposure. Okay, so what are some pretty easy ones? Well, stop smoking. Smoking is 80% of lung cancer deaths. Eating a healthy diet, one that's things like eating a high fat, low fiber, increased weight can increase the risk of cancer. Don't quote me on that page number because you guys have okay, so it's going to be page 2023 in your book. It's from the old version, sorry. Page 2023 are foods to reduce cancer risk. Also avoiding excessive exposure to the sun, like even including indoor tanning beds. Some people, there's this misconception that if I don't smoke tobacco, if I chew it or anything like that, it's not harmful. Yeah, it is. You have an increased risk of mouth, larynx, and esophageal cancer. Avoiding excessive alcohol consumption, your increased risk if you drink more than 2 drinks a day. You increase your risk of cancer. Prevention also includes exercise regularly, adequately resting, so not stressing yourself out all the time, and also regular medical exams. So how do we know, how to look for cancer or what age or what kind of test? Well, here in the United States, we follow the USPSTF, so the U.S. Preventive Services Task Force. It's actually even an app. So if you go online and you just type in USPSTF, it gives you this algorithm. So you put in, it usually asks the patient's age, their gender, do they smoke, are they sexually active, do they, I don't know, if they have heart disease. It asks you a few really quick questions, and then boop, it'll pop up. It gives you recommendations for screenings. A is the priority, and then it goes lower. So B is, kind of your discretion, and C is not really indicated, but, there is a little bit of wiggle room. So I included the link there just so you guys can be familiar if you're trying to remember or learn, okay, 65 and older, what kind of screening should they get? Females, what screening should they get? That's a great way to learn it. But I've also included it in this PowerPoint. So the first thing let's talk about is breast cancer. So breast cancer occurs mostly in females. This is a female cancer prevention. How do we screen for breast cancer? Well, in women 20 years and older, we recommend that you do a self-breast exam at home. And this little picture is just a kind of a little handout that I even give to my patients in clinic about like how do you do a self-breast exam. If they come in for a well woman, I also show them in person how to do it themselves. What are they looking for? Well, they're looking for new lumps, new bumps, if there's anything red or bothering them that's new. But routine screening starts at 40 years old and it's every year. Okay, so the screening guidelines for breast cancer used to be at like 55 every 2 years, and it went down to 50 every 2 years and 45. But now we're starting it as early as 40 years, and every year if there is a family history of breast cancer. And I've included a YouTube video on what a mammogram is there. Another female cancer screening test is the Pap test. Fun fact, the Pap test is actually called the Papa Nicolau test, and that's the last name of the dude who invented the Pap smear. It wasn't even a female, it was a guy. So a guy named, so something Papa Nicolau invented this test. Just a fun fact. So here's a video on a brief overview of what a Pap smear is. It is animated, don't worry. And what are the guidelines for cervical cancer screening? Well, for we start at the age at 21, but you can, if you've never had sex, then you can push it to the age of 25. But we do recommend starting at 21, and it's every 3 years. And then starting at age 30 to 65, we screen every 5 years. But we not only test the cervical cells, but we also test for this thing called HPV. Now, if you're in your like 20s, 30s, probably even 40s, you probably got an HPV vaccine when you were a teenager. And HPV, the virus, human papillomavirus, has been found to increase the risk of cervical cancer. So we give the vaccine usually 9, 10, 11, 12 years old before a child is sexually active to reduce the risk of exposure to HPV. And so HPV, we don't even test in the 20s because, I don't know, it's actually one of the most common, most prevalent STDs or STIs, but it's something that can come and go. So you get infected with the virus, very similar to like the flu bug, and then it goes away. But if you test positive for HPV in your 30 to 65 year age, your risk of developing cervical cancer does go up. So that's why we care about it at the age of 30 and older. Colorectal cancer, remember, both in men and in women, it's one of those top 5 cancers. It affects men and women, and we screen 50 years and older. This has actually been updated since I taught this class. It's actually starting now at 45 years old and older. How do we screen for colon cancer? Well, there's a few different options. The first one is called the FIT or the FLBT. But basically, it's this at-home kit that you take home with you. You have a bowel movement, and it comes with like this little device that you take a few samples of your stool, and then you send it back. I did put a link to a video if you guys have never seen a colorectal cancer screening kit. That one is pretty easy, right? Everybody, I tell my patients like, well, I know you have a bowel movement at least once a week, right? So you can do this test. It's not invasive. It doesn't cost you anything. You don't have to go anywhere, but it's not the most accurate. It's not what we call the golden standard, right? So this one, you have to do it every year. It has to be annually. Okay. Some patients who say, well, what are you testing for? And we're testing for fecal occult blood. And you patients might say, but I don't see any blood in my poop. Why do I have to do this? Well, because we're looking for microscopic blood in your stool that you may not see with the naked eye. So it's very important. So it's non-invasive. You do it at home, but you got to do it every year. The golden standard is going to be more invasive. It's a colonoscopy. It's a oscopy, so you know that means it involves some type of camera scope, some type of orifice. It's in the colon, so it's through the rectum. I've included some links about what does that look like to prepare for it and what is a colonoscopy. So colonoscopy, it actually visualizes your colon. It is invasive. You don't have to do, you're not like with general anesthesia. It's called twilight anesthesia. So the patients relax. They don't feel any pain. But a key patient teaching with colonoscopies, if a patient goes, oh my gosh, is it going to hurt? The best response is going to be, you might feel some cramping, but it's not painful. So cramping, okay? So it's cramping. It is outpatient. You don't have to be hospitalized. It's fairly quick, maybe 1-2 hours max. But the thing about it is that because of the anesthesia, you have to have somebody drive you there and drive you back and kind of watch you for a few hours after the colonoscopy. And the most bothersome part of that is going to be the preparation. And so just watch the video so you can see the prep. Another option that's not very common is called the flex sigmoid. So the flex sigmoid is similar to a colonoscopy, but it doesn't examine the whole colon. It's just the sigmoid part. It's only about 2 feet long, so maybe less than half the colon. This test isn't really used because it doesn't look at the whole colon. It just looks at the sigmoid part of the colon, okay? So what's the point of doing that procedure if you're not going to look at the whole colon and make sure I'm completely with it? It's like if you did a mammogram on only one breast instead of both breasts. Like it's incomplete, okay? Lung cancer. How do we screen for lung cancer? Well, remember when I said that 80% of lung cancer cases are related to smoking? So we're going to do a screening for those who are smokers, either current or even former smokers, starting at the age of 55 to 74, and if they've been smoking for at least 30 years. When it says pack year history, that means 1 pack of cigarettes per day for 30 years, okay? How do we screen for them? Well, we're going to give them a low-dose chest CT scan, and I included a video on here. It's not invasive. You just got to schedule an appointment. That's all. And this one is annually. Prostate cancer is in males. We're going to screen 50 years and older. This one's there's not really a definitive screening test for prostate cancer. There is some debate about this blood test called a PSA. So if you're 50 and older and you come in for a physical, I might talk to you about like prostate cancer and this test that I can offer you. It is a blood draw, it comes back with the rest of your labs. What we're looking for is to make sure that it's within the normal range that's specified. I think it's lower than 4.5. Don't quote me on that, but it's probably in your book. But an elevated PSA level might be indicative of prostate cancer, but not always. It's not always directly related to prostate cancer. It might be an enlarged prostate. It might be a prostate infection or a UTI that the man just hasn't treated yet. It could be from an STD like chlamydia or gonorrhea that hasn't been tested yet, because remember, your prostate is right there underneath the bladder, and the urethra, right, travels right along the edge of the prostate. So if the urethra is inflamed, it could rub and irritate the prostate, which might make the prostate lab high. Okay, so here's a video on the prostate exam, the PSA test. The other option is a digital rectal exam. This is just a physical thing that we do. It's just like it says, a digital rectal. So we insert the digit in through the rectum, and you can palpate the prostate. If it is enlarged or swollen, number one, it's going to be very painful, not just uncomfortable, but like painful, like very sore to the patient. And then also it'll feel enlarged, almost like a lump on a woman's breast. you would feel that in a digital rectal exam. You would feel an abnormal lump that's different from the rest of the rectum. And there's a video explaining the digital rectal exam. What are some warning signs of cancer? And outside of the screening tests, we always want patients to be aware of the warning signs of cancer and not wait until they're 40 years old to get the mammogram or wait until they're 55 to get that low-dose CT, right? So there's different warning signs in cancer, including changes in bowel or bladder habits. And these are like unexplained changes. Like all of a sudden now I'm having a lot of diarrhea, I'm having a lot of constipation, I'm having difficulty peeing, or I can't stop peeing, or I see blood in my stool or urine, that kind of thing. Sores that don't heal, especially in the mouth, because our mouth heals quickly just because of the cells are rapidly growing cells. So if you've got a sore in your mouth or on your tongue that's not quite healing, definitely need to get that checked out. White patches inside the mouth or on the tongue, you might think of like thrush or some other type of fungal infections. This might happen with a weakened immune system caused by cancer cells that would cause the infections. Unusual bleeding or discharge anywhere from your body, thickening or lump in the breast, or even elsewhere, a lump in your underarm, a lump under your skin, anywhere, you want to get it checked out. Indigestion or difficulty swallowing, we're kind of concerned about esophageal cancer, like you can't pass fluid or food down, but you feel like you have a lump in your throat that might be related to thyroid cancer. Recent changes in warts, moles, or skin. This is looking out for basal cell carcinoma or melanoma, or this like nagging cough or hoarseness. And that's kind of hard for smokers, right? Like, or if you have allergies, or if you have asthma. Oftentimes I see these symptoms kind of brushed to the side from providers sometimes, or from healthcare professionals, like, well, it's just your asthma acting up. But then I look at their chart and like, when was their last chest x-ray? Like, have we looked at their lungs? Have we looked, like done a study to make sure that it's not cancer? Here's a slide of some common terms that are used in cancer. Number one is neoplasm. Neoplasma, new. Plasma, new growth. This is abnormal or uncontrolled growth. Benign. So if you have a benign tumor, this is a tumor that's non-reoccurrent or progressive. And when it comes to cancer, we want benign. Okay, benign means, not 911. We're gonna, it's not normal, but it's not cancer, like the, bad, like, we need to get chemo and all that kind of stuff. Malignant is abnormal growth of the cells with the loss of normal roles or function. This is the bad cancer. Tumor is a growth. It could be local or invasive, meaning like a tumor outside your pancreas versus inside the pancreas, a tumor on the outside of your lungs versus inside the lungs. Metastasizing means like our tumor cells are spreading from the primary site to a secondary site, like somebody who has pancreatic cancer that's now spread to their spinal cord, breast cancer that's now spread to their lungs, that kind of thing. Immunosurveillance, this is the immune system's recognition and destruction of newly developed abnormal cells. Our body does try to do its best to get rid of the cancer. Characteristics of malignant cells, well, these are rapidly growing, they're irregular, they don't look like normal cells under the microscope or on an imaging study. They're rarely contained within a capsule, meaning it doesn't follow the regular borders of like a lung or an organ or something like that. Malignant cells are capable of metastasis, again, spreading to a secondary site, and they look very weird. They don't look like normal cells where they're coming from. Metastasis is when tumor cells spread from the primary site to a secondary site. And once the cancer cells have moved to another area of the body, that secondary tumor can grow in that area, but the cancer is still named for the tissue of origin. So for example, if I have lung cancer, those lung malignant cells are going to continue to replicate and move to my kidneys. right? So now my kidneys have cancer cells, but it's still going to be on my chart. It's still going to say lung cancer metastasized or something like that. Okay. It can be from direct spread of tumor cells by diffusion to the other body cavities, or it can be through circulation of the blood and lymphatic systems. That's how the cells spread in the body. A normal cell life cycle is when a cell is destroyed or dies, the same type of cell is reproduced. The immune system destroys abnormal cells. That's our checks and balances. So if it doesn't, think of it like quality assurance at a factory, right? You've got a factory line, you've got a product coming out, and if it doesn't look perfect like all the other ones, the immune system will toss it, will take it off the line. But what happens in cancer is that maybe the cells are reproducing too quickly for that checks and balances system, and the abnormal cell passes through the immune system. Reproduction is really chaotic. It's unrestricted. It just kind of blows up. The specific term for abnormal cell growth is proliferation. Now neoplasms, which is a cluster of cells, it could be malignant or benign. Let me update what page that is on for neoplasms. 50. So it's going to be 2027. Page 2027. So there's a chart in your book where it's benign tumors versus, malignant tumors. Metastasis is either spread by primary, secondary site, like I said, either diffusion, like my lung cells are going to go through and invade the kidney tissue, or it's going to get to the kidneys through my blood or lymphatic system. Our immune system is supposed to respond in a healthy body through immunosurveillance, where our T cells, we recognize that cell's abnormal and it'll destroy it. But sometimes our T cells can be weakened and not capable of destroying those cancer cells. Factors that can cause weakening would include age, right, as really young and really old. Medications, some medications can weaken our immune system, poor nutrition, alcohol use, or even a serious infection. Tumors, when it comes to tumors, there's a few different terms used. Carcinoma is going to be epithelial cells. And where are epithelial cells again? This is going to be our mucous membranes like skin, any kind of glands in our skin, mucous membranes lining our respiratory, our GI, and the GU tracts. And these tend to metastasize just because they're connected to everything, right? Like your GI system is from your mouth to the rectum, and it kind of is pretty close to everything, right? Sarcoma, when you hear the term sarcoma, it's relating to connective tissue. Connective tissue, where do you find it? Muscle, bone, our fatty layers, in the bladder, kidney, liver, lung, spleen. We've got connective tissue in all those areas. If the tumor, is termed a lymphoma or leukemia, this has to do with our hematopoietic system, so our hematological system relating to our cells. Tumors are also graded and staged. So grades 1 through 4 is the degree of malignancy. So this means and let me find the page for you. It's going to be 2026. I'm sorry, 2028. My balls are not working today. 2026. So this is going to be malignancy, like how well differentiated or how abnormal are the cells. And then stage 0 through 4 is going to be the extent of the disease process, like how much it's spread. So cancer staging and grading are two different things. Grade is how abnormal the cells are, and stage 0 through 4 is how much it's spread. I think most commonly we refer to cancer through staging, like it's stage 4 lung cancer. And so when you hear stage 4, it's oh my God, it's spread. It's a very bad case versus stage 1 or stage 2, where it might be more localized.
Miss Sally, quick question.
Yeah.
Now, would you say for a benign tumor, would that just be started off as a grade 1 or 0, and then if it's malignant, it would be graded 4 4?
Yeah, so let's see. Let me find in your book, does it give you like a benign one? Um, let's see, grading. Let me find that page again. Hold on. Yeah. So benign would be, yes, benign tumors are usually mostly going to be lower on the grade and the stages. So remember, grading is like how abnormal are the cells, right? Like maybe we have in our breast tissue a cluster of some mildly abnormal cells, but it hasn't spread. So the lower the number in both of those, the better the case is. Does that answer your question?
Yes, it does. Thank you.
Okay. Yeah. Here's another, the TMN classification. This is going to be on page 2028 for you. So again, the T, the M, and the N. This is another way to classify cancer. Let's see. Okay, so so let's go over, like, for example, cervical cancer. Results are either normal or there's a lot of different types of abnormal. Like I mentioned earlier, you could be positive for HPV, which increases the risk of developing cervical cancer. Tests might come back with this word dysplasia, which means like slow progression, and it may progress to cancer. We've got some other terms like we call them LESL or HSIL. This is like, it's like the name, like LESL, low grade. These are abnormal cells that usually resolve on its own, like an HPV infection. But a high grade, remember, higher the grade, the more serious is. This is a moderate severe abnormality, and cancer might be present. So patients who usually come back with HSIL automatically get referred to go get what we call a colposcopy, or a biopsy of their cervical tissue. To remember, because biopsy is the only way to define, like, definitively diagnose cancer. How do we treat cancer? Well, we want to either remove the cells or the tumors through surgery, like removing a polyp during a colonoscopy. This is kind of considered like a prevention. This is like an abnormal growth. It almost looks how I describe it to my patients, it's like a skin tag. So it's like they go through the colon with a camera and they see this like little thing pop out on the side of on the wall of your colon, your intestine, and they're gonna snip it because they don't want it. Something clearly is triggering that skin tag to grow in the colon, and so they're gonna snip it and send it to the lab to make sure it's not cancer cells. Radiation is another type of cancer treatment. The purpose of radiation is to shrink the cells, so prevent it from continuing to multiply and grow. Radiation could be external or internal. External radiation is kind of, you want to think of it like a sunburn. I have a patient going through radiation treatment for breast cancer. So she had the lump removed through surgery, and then they did radiation to get rid of all of the cells that might have been left behind from the surgery, and it's because they shine the rays directly on the skin. Patients are going to have a pretty bad, I mean, it's like a really bad burn. It's very painful and uncomfortable. Internal radiation would be like radioactive iodine. Can anybody tell me what radioactive iodine is used to treat? What type of cancer? Do you want to type it? When you think of iodine, what part of the body? What's iodine related to? Yeah, the thyroid. Remember, somebody who has thyroid cancer or a thyroid issue, we actually tell them to stop ingesting iodine because our thyroid needs iodine to function. So we take away iodine and then we give them radioactive iodine, and the thyroid will swallow it up, and then it kills the thyroid. It's kind of cool. And then the third option is chemotherapy. This is where we're either given an IV infusion or pills to slowly kill the cells. But chemotherapy, because it is ingested or inserted through the bloodstream, it does have systemic, so widespread side effects. If your patient is going through surgery for cancer treatment, things that you want to consider and address is their pain, number one. Also providing emotional support. This is where your therapeutic communication skills are going to be really valuable. You need to validate the patient's feelings. So if they are scared, don't give them false hope. Remember, like, oh, don't worry, you'll be fine. You know, you'll be cured of cancer after this, right? Don't be lying, okay? Don't give them false hope. Make sure that the information that you give them is factual and honest. So, you know, keep it to medical and what you've seen so far. So because of the disfigurement, possibly, or the scars that are left related to surgery, they may benefit from attending support groups or community resources to help, you know, I don't know, live their new normal, I guess, after getting surgery for cancer. Because you got to think about it. If somebody has, I don't know, for example, breast cancer, you know, that kind of surgery is very different than like, you know, like a mommy makeover, like a breast reduction or a breast surgery, right? Cosmetics don't matter. They're not the priority when it comes to cancer treatment. They are going to cut whatever they need to along what we call the margins or the borders of the cancer tumor. So a lot of people struggle after surgery. As with any other surgery, we're going to monitor infection, bleeding, and complications, and definitely promoting a healthy nutrition, healthy diet to recover from surgery. Can anybody tell me what nutrients or vitamins are important for wound healing and recovering from surgery? Do you guys remember from term one? I hope so. Protein, and who else besides Justin? Who else? Protein and what? Zinc? Absolutely. I'm looking for a vitamin too that helps with our immune system. Vitamin C, you got it. Yeah, protein, zinc, vitamin C, these are all super important nutrients to recover from surgery and wound healing. Radiation, it's like a sunburn, but like really, really bad. It's terrible. It's very painful. I have a few patients going through radiation. It is terrible to see them go through that. But unfortunately, it doesn't just affect the cancer cells. It's going to affect the cells wherever the radiation is being targeted. But it's usually reserved for cancer that's spread to lymph nodes, or if surgery is not an option yet, because it'll shrink the tumor and then do surgery. But in my patient's case, they did the surgery first because the lump was so big that they were able to see it, and then they did radiation to remove any lingering cells. Because it is an external, for external radiation, we're going to keep the skin dry. Don't put any lotion or deodorant in that area. No direct sunlight. Avoid hot and cold compresses. And then encourage a high protein diet and increase hydration to recover from it. For internal radiation, let me update that page for you. Internal radiation. Yep. 2036. Yeah. So on page 2036, box 57.3, there's instructions for nursing how to care for patients treated with internal radiation for thyroid cancer. Things like pregnant women and children have to stay away because the person who ingests the internal radiation, they are themselves like radioactive, I guess you would say, and that can affect other, like especially pregnant women and children, they have to stay away. My good friend in high school, her mother had thyroid cancer and had to do this radioactive iodine, and I remember coming over, and the mom was in the room for several days, I want to say. Nobody could handle the bed linens. Nobody could handle her trash because any kind of sweat or anything that comes from her body had radiation in it. So she used, I remember there's a big black trash bag inside the door of her room where she disposed of everything, and then they would like open the door, leave her food there, and then come out to minimize the risk. Chemotherapy, the purpose of chemotherapy is to reduce the size or kill the cancer cells. Again, it's they're given IV or PO. But it can attack regular cells too that reproduce rapidly, like our hair, our nails, and our GI tract. So this is why patients who go through chemo have side effects that affect their hair, like hair loss, brittle, weak nails, or nausea, vomiting, sores in their mouth, diarrhea, that kind of thing. Because it is a systemic medication, you might hear this term chemo brain. This is where patients who go through chemotherapy may experience forgetfulness or poor concentration. A helpful tool would be writing things down daily, having a daily planner, or even stimulating the brain through using like brain puzzles. And then one of the downfalls of chemotherapy is it can result in leukopenia because, again, it doesn't just attack the cancer cells, it attacks other regular cells, including our white blood cells. And if we have decreased white blood cells, we're at increased risk of infection. So that's why patients who are in chemotherapy are going to be under neutropenic precautions. Can anybody give me an example of what's included in neutropenic precautions? When you see neutropenic precautions, what do you think of? Yeah, no large crowds, reverse isolation, that's correct. So instead of like negative pressure where their room air goes outside of the building, they're going to have their own internal, like, I don't know, I lost my, like internal airflow so that the outside air, like from the hallways and other people, don't go into their room. Yeah, and no raw foods or veggies or raw meats because that can harbor infection, and no visitors. Oh, you guys remember from term 1. Lovely. Okay. And then the rest of these slides, the last 3 slides, are just kind of a knowledge check. I would go through them and just ask yourselves, like, do you know the signs and symptoms of endometrial cancer, laryngeal cancer, and skin cancer? You may see some questions on those. What are some foods to prevent cancer, chemotherapy symptom relief, side effects of chemo and radiation, and then the treatments for them, risk factors for cancer, and so on, okay? Just to kind of, you're like, how do I know if I know cancer? Just go through these bullet points. It's a good summary of the chapter. Any questions on cancer? I'm going to stop sharing the screen, and I'm going to stop the recording, and then if you guys want to ask me any questions. Feel free to unmute yourself. If there's no questions for cancer, does anybody have any questions for the HIV or the immune system, what I lectured on last week?
Acute retroviral syndrome.
You guys don't have any questions, you can log off. Remember, I'm available by remind, email, wherever you guys want. Acute retroviral syndrome, Justin. Okay. Tell me, what's your question on that one? While I get in my book. What is it? Did you guys have a question on it? Let's see. I'm still looking. Hold on. So acute retroviral syndrome is with the actual virus of HIV is replicating during that acute infection period. So this is when, remember, during stage 1, the viral load is really high, and then it declines right before we can see antibodies. Do you remember that?
Mm-hmm.
Okay. Yeah. So this is when the viral load, so in your book it says the viral load peaks at millions of copies of virus, and then the viral load declines right before it becomes detectable in our blood. So remember I mentioned that HIV can take 4 weeks and longer to become positive on a screening test. It could be even as long as 4 to 6 months after. So when I think of the acute retroviral syndrome, I also remember like PrEP and PEP. So PEP is actually post-exposure prophylaxis. So if you've been exposed to HIV, starting on prophylactic HIV medication will prevent that virus from rapidly replicating and growing, the peaking at millions of copies. It'll stunt it a lot quicker to prevent the development of an HIV infection. Kind of like how I can describe it is like, I don't know, when you get bit by a dog or you get stabbed with a nail, what do they do in the urgent care ER? They're going to give you a tetanus shot to prevent the development of tetanus, right? They give you a Tdap shot to prevent it. So same thing with PEP, post-exposure prophylaxis. They give you this medicine. Usually, it needs to be usually within 24, 48 hours of the exposure, whether that's through a needle or through a sexual encounter, to prevent that virus from growing. Yeah, the syndrome is just the replication portion of the HIV. Yes, so it's that stage 1 where the virus grows, millions of copies.
Okay.
And the patient's sick. Remember, they have like flu-like symptoms and stuff like that. Any other questions, you guys? I'll stay on if anybody else has any questions.
Tumor lysis syndrome.
If not, you can always message me. Tumor lysis syndrome. It's part of your immune system, right? The immune system chapter.
That's cancer.
It's a part. Oh, they put that in the cancer one?
Yes. It should be under chemo.
Almost there. Almost there.
Oh, it leaked a little. Smells good.
Oh, okay. So tumor lysis syndrome, I just had to refresh myself. So remember, lysis is destruction or elimination of something. Lysis is breakdown. So it's a breakdown of the tumor. This can happen if the cancer cells or the tumor cells are destroyed too quickly. So think of it like, I don't know, any other cell that's destroyed, whatever was in that cell is going to be released into the bloodstream, including contents like potassium, other electrolytes that are harmful if they're too high in our bloodstream. This is why patients who get radiation or chemo, it's over several weeks, if not months, right? So they're slowly breaking down that cancer or eliminating the cancer to prevent tumor lysis syndrome. If something breaks down too quickly, it's going to release everything that was in that cell, which can be harmful, like, uric acid and potassium and things like that. So if anybody develops or shows signs of like hyperkalemia, hypercalcemia, elevated uric acid in the blood. You're going to look out for those symptoms because they may be due to a tumor lysis syndrome, the patient's on chemo. Any other questions?
Miss Elliott, this is kind of like a dumb question, but I was having an argument with a classmate, and does radiation cause alopecia, or is it just chemo? You know?
Thank you.
I would think that radiation would cause alopecia if it was like the radiation was on their head.
Okay.
And most often it's going to be chemotherapy because of the systemic effect. Yeah.
Okay, I'm gonna go tell that person that they're alright.
Okay, it's on record, you guys. Make sure that he tells that person. All right. Any other questions? You guys, is this your last exam for med-surg on Monday or Tuesday? Do you guys have a final?
Yeah, I think.
Like a comprehensive final or just this exam?
We have this exam and then a week after is our final.
Okay. Well, I will touch base with Miss Webley next week, and next Thursday session will be a comprehensive final review. Well, if you guys don't have any other questions, we'll log off and just message me if you think of anything. Yeah. Justin, do you have any other questions?
Probably, but I'm getting this right.
All right. I'm happy to help you guys. I'm going to log off and post the PowerPoint and the recording right now for you guys. Have a good night. Well, Justin just messaged me a reminder. I've been added to your guys' class, so you can send me a message. Good night, you guys.